And Dara, do you want to kick things off?
Sure, thanks, Danielle. Good morning, everybody. Thank you for joining us for the Hcbs rules implementation in a COVID world. Our first part 4 of our provider training series, and this is for the settings of DD group homes and developmental homes. So we recognize these settings, while they are DD residential settings, certainly have very different characteristics and setting experiences for our members. So we're certainly looking forward to talking with you about those today. Next slide, Danielle. A little bit of housekeeping. We definitely have a small presentation to help set the tone and the kind of level set for everybody to help support the conversation for today. So we do have a short presentation. We will mute you during that portion as well as throughout, just to make sure we can mitigate any disruption from background noise. After the presentation part, we really do want to have discussion and dialogue. This is really designed to be a peer-to-peer discussion and dialogue, just facilitated by us, so that you all can learn from one another. We're hoping that some of you would be willing to come off of mute and share your experiences with us. So if you'd like to do that, you can use the raise your hand feature. And then Danielle will facilitate unmuting you one at a time to allow you to engage in the discussion, share, ask a question or share a comment or some feedback. For those of you who might be a little more shy and might want to utilize a chat function, we are going to use the question and answer box for you to include your questions or comments. If you like what somebody has, a question that somebody has raised, meaning you have a similar question to that, or you want to just give them some kudos to say you like that comment, please go ahead and use the like button, very similar to Facebook. And then what we'll be doing is we'll be kind of going back and forth between those who are sharing verbally with us, as well as those who are sharing via chat. So we will reference the Q&A chat during the meeting as well, just to draw attention to it. And then certainly if you just want to share an idea that you have or a comment, please use that Q&A box as well to do that. It just helps us capture some of your input and ideas to help us inform our work in supporting you in efforts to comply with the Hcbs rules as we continue to move forward in that process. Next slide. So our objectives for today, it's certainly been some time since we've all been together to talk about the Hcbs rules. And so we want to make sure that we're starting from the same place and setting some just basic understanding so that we can all engage in conversation today. So the first thing we'll do is we'll go over a refresher of the intent of the Hcbs rules, which is really kind of what we use as a litmus test for compliance, right? Are the policies and practices that we're introducing into our programs, are these things that really address the overall intent of the Hcbs rules? So it's really important that we understand that. Danielle's going to help to talk through what do the rules look like in practice. So these are really the assessment questions that you'll all be getting throughout the year as you start to receive technical assistance and monitoring from DDD. So this is also really important just to help, again, frame the discussion for today. Danielle will also give an overview of what you can expect with the quality monitoring process. You get that monitoring today, but it's going to look a little bit differently. The process will be a little bit different, both the tools and the process to gather the information to ensure that we can document your compliance. And so she'll go over that just so you have that as a frame of reference. But really the goal for today is to have some facilitated brainstorming and discussion. We want to hear from you and basically sharing your practices with your peers in the industry of what you've done to try to align with the specific person-centered practices required under the HCBS rules. And then also, what are some of the challenges that you're experiencing or anticipating experiencing? We'll talk a lot about how COVID has impacted these practices and how we can focus our attention on trying to come back stronger than where we were before COVID, now that we're sort of starting to transition into quote unquote more normal life. So we want to talk a little bit more about that later on, but this is definitely an opportunity to hear directly from you and to share and to help facilitate that discussion amongst your peers in the industry. Next slide. So the intent of the HCBS rules, first and foremost, it's about enhancing the quality of the services. A lot of the standards around the HCBS rules are really about member experience, so enhancing that quality. We also look at the rules as rights afforded to all members. So it does provide protections to participants to make sure that they're getting the full access to the benefits of community living. We understand that these rights, we look at them as something that people don't have to earn. They automatically get them. But if there is a legitimate health and safety reason why they shouldn't be able to do those things, then there's a process through the person-centered planning process to document that and to work on it and to support that person. So hopefully we can get them to a place where they have that, they have access to that in the future. So the key point about those restrictions are that they're individualized. This is a culture shift for us. We've for many years run programming around giving people more independence when they've earned it. And sometimes we've also put restrictions on activities for the home in this case, versus doing them on an individualized basis. So it's definitely a culture shift. But the overall goal is that because of the work that you do and because of what you have been doing, people receive services in Arizona in integrated settings. We're one of the states that have the best opportunities for that. And so there's no question about it. So this is really our opportunity to take a look at, okay, how do we make integration even more real for these folks, for our members? They're living in integrated settings, but how do we support them to be engaged in a meaningful way in relationships, in connections with people, but then also in activities? So this is really the overall intent. When you encapsulate the HCBS rules, these are the things that we're talking about that are the priorities and focus of our attention. And I think with that, I'm going to turn it over to Danielle to go over, okay, so what does this look like in practice? Understanding that some of you support individuals directly in your family home as part of a developmental home, and others of you manage and operate group homes. So what do these standards look like for those residential settings?
Thank you, Dara. So we're just going to go over at a really high level what the HCBS rules might look like in your setting. We do have a lot more detailed information available on our website, including previously recorded provider trainings, and we'll point you to those a little bit later. So the HCBS rules afford our members employment services and support. As a home, this doesn't necessarily mean that you have to directly provide those employment services, but we want to make sure you're supporting the individuals who live in your home. I also do want to level set that this session is for DDD group homes and developmental homes, which, the age groups can vary widely. So if you are working with children, these rules are going to look a lot different. Just consider and keep in mind whatever is normative for that age group is what we would try to attain. Of course, we're not trying to send 8-year-olds out into the workforce. So I know that's a little bit difficult, but try to keep that in mind. Because we'll be talking about the Hcbs rules at an adult level. So we want to make sure the setting engages individuals of working or school age to see if they're interested in work or school. And if they do express an interest, we want to know that you're able to refer them for those employment services or schooling. We also want to make sure individuals have transportation to and from their work or volunteering activities. This doesn't mean the home has to necessarily provide the transportation, but that you're working with the member to find those supports they might have available through family, friends, or coworkers to obtain that transportation to and from work. Engagement in community life. We want to make sure people need support to assist them in participating in activities in the community, that they have that support. We want individuals to have regular opportunities for contact with people who don't live in the home and are not receiving services. This obviously looks a little bit different since we're in the middle of a pandemic. But when we get more back to normal, we just want to know that you know, they're engaging in their communities. So people are able to go out to their church or even the park or library or just places where they interact with other people. And this could also include people coming into the home, you know, to participate in an activity, maybe provide a music program, things like that. We just want to, just like we all, you know, interact with people who live outside of our home, we want to make sure our members have that same opportunity. Do individuals participate in activities and integrated settings comparable to peers? So, you know, really just think about what's normative for people of that age group. For younger people who might want to attend concerts or go to movies, again, understanding it's not happening right now, but when it does happen again, is that something you can support them in doing? Obviously, maybe not paying for a concert ticket, but helping the person find those supports that can get them there if that's a goal of theirs. And we want to make sure people are, again, doing things that are normative for their age. Do we have elderly people sitting in groups, you know, coloring if that's not really their interest? So a lot of engaging your members and finding out what their actual interests are would probably be very helpful in this area. Control of personal resources. We want to make sure if someone needs it, they have someone to assist them in managing their funds. We want to know that people are being able to decide how to spend their money and that they have access to the community to spend that money. So this could be something as simple as, you know, I want a Coke, the home doesn't have any Coke, you know, in the fridge. So can I walk down to Circle K and buy a Coke, you know, with my own money, barring there's no health and safety risk? If people are working, are they being paid directly or is that money going to the representative? And then for people who either are employed or are preparing for employment, are they given information about how their benefits might be affected by employment and income? Access offers a DB 101 course that kind of provides this information for how employment income can affect benefits. So again, not something we're really expecting the home to provide directly, but just making sure you're supporting people and finding those resources that they might need. Receive services in the community to the same degree of access as other people. Our members, given the choice and opportunity to freely exit the facility, free from a curfew or other requirements for a scheduled return home. Again, this is without any individualized restrictions because of health and safety issues. If an adult who doesn't have those health and safety issues, are they able to come and go from their home as they please? Just like in my home, if I want to take a walk, you know, at 10 o'clock at night, I'm free to do that. No one's going to stop me, and I can also return to my home and, you know, go to bed. So we just want to make sure other adults have those same rights, again, barring those health and safety restrictions. Do individuals have access to transportation to and from the setting for purposes of engaging in community life? And I'll stress again, not necessarily the home has to provide it directly, but if someone wants to go to church, are there family members or church members who can help get them there? You know, really just problem solving with the member and helping them access the community in the way that they want. Setting selection, looking very different right now, but are people allowed to visit the setting prior to choosing to live there? So, you know, tours, sharing a meal, participating in an activity, just like it's normative for any of us to tour a home before we choose to live there. We want our members to have that option. I know because we're in the middle of the pandemic, some providers are doing this virtually. And I'm sure there's even more creative ways out there to try and make sure that members can kind of visit the setting prior to deciding to live there. Person-centered plan. So we just want to make sure that you as the home, that you're participating in those person-centered planning meetings, that you're supporting your person to participate in those person-centered planning meetings. You guys being with DDD, you know how important they can be. We want to make sure you're able to provide updates on a person's progress or changes that could impact their goals. And of course, we want to make sure that your program plan aligns with that person-centered plan. So, you know, whatever the members' goals are, that we're all working together to kind of help and achieve those goals, even though your role may be, you know, could be very large or it could be very small, depending on the those unpaid supports the member has available to them to try and help attain those goals as well. Privacy, dignity, and respect. This is something I think that most of us already do well, but we'll cover it. We want to make sure people are receiving personal care assistance in private, that they get information about their rights in plain language, and that they know who to contact if they do have some concerns or complaints. And of course, we want to make sure our members are protected against restrictive measures, including isolation, chemical, pharmacological, and physical restraints. Autonomy and accessibility. We want to make sure people get to make informed decisions about what they want to do every day, just like anyone else. And of course, we know you have some constraints because of staffing, so this may not look like everybody doing something different in a day, but maybe if there's a shopping trip planned and I don't want to go, is there a way for me to stay in the home and just not attend the shopping trip? Things like that. Making sure the setting is accessible for people to safely and freely move around. So this is less about ADA compliance and more about making sure, you know, that the kitchen isn't off limits at any certain time. Again, this is people, you guys are, you know, people live with you. These are their homes. So in my home, I can go into the kitchen at any time. I may not be able to prepare a meal and wake everybody up at midnight, but I can definitely go in and get a snack. You know, so we just want to make sure people have access to all the areas of their home that they should have access to. Individual choice. Do members have the option to make a request for alternate staff members to assist them? I really like working with Dara, so is there a way that we can work it out so I get a little bit more time with Dara when she's scheduled? Obviously something that may not occur tomorrow, but is it something we can work together toward? We know that you have some staffing constraints that may affect your ability to honor those requests. So just working towards things, really. And can people make those requests for changes in the way that their services and supports are delivered? So we have some additional requirements for provider-owned or controlled HCBS settings, which you guys fall under, being a home. It's important that people have access to a key to their bedroom. You know, so if I am going to leave for the day and I have all my valuables in my bedroom, can I lock the door? Again, barring those health and safety risks. Are people allowed to decorate their own room, including moving furniture and hanging up items on the walls? Of course, if they have a roommate, this might be more of a conversation. But if I don't have a roommate and I want to decorate, you know, my room and concert posters or whatever, am I allowed to do that? Do individuals get to choose their roommates if they have one? Of course, this is something we understand may not happen tomorrow, can be difficult to finagle. But if I really want a room with Derek because we get along, you know, can we just keep that in the back of our minds, and then maybe someday if we're able to do that, we can work towards that. Do individuals have access to a key or code to their front door or entrance of their home or setting? Again, this is a person's home. If they don't have those health and safety risks, can they have a key to their front door? This could also look like a code. It could just look like someone who is available at any time of day or night to open that front door for them and let them back in when they return. And do individuals have a choice on what time they want to eat? So, you know, like my example earlier, I would not cook a whole meal at midnight and wake up my family. They would have some things to say about that. But if I'm hungry, I can definitely run into the kitchen and grab a banana or whatever will satisfy that. And kind of going along the same lines, do individuals have an opportunity to purchase their own food, snacks, or drinks? So, of course, we don't expect the home to provide snacks for everyone at any time of day or night. But if I have my own money and I want to go buy my own snacks that I can eat at any time of day or night, can I do that? Is that a possibility? We want to make sure people are free from restrictions, which include visiting hours on when they can have friends and family over to visit. I'm going to go back to the example of my home. I can have, you know, my mom over whenever I want. If I start having, you know, loud parties at 2 or 3 in the morning, my family's going to have a conversation with me, and we'll have to maybe come up with some rules on what's appropriate or not, which is totally acceptable. Of course, my mortgage company wouldn't be part of that conversation. It would just be a conversation with people who live in my home. And then, do individuals or representatives have a written agreement in place providing protections to address termination of residency and due process and appeals? This is something we're working on directly with DDD on to have a standardized form for everyone, but that may be a little bit down the line in a process, and it'll go through that whole policy process probably. So a lot of information about what we're kind of looking for with the Hcbs rules. For the actual quality monitoring that takes place, it's very similar to the process you all go through now, either annually or more frequently. But essentially, your health plan DD will send you a self-assessment to complete. So you'll answer how you think you're doing as far as complying with the Hcbs rules. You'll provide some documentation examples of your policies, maybe pictures, flyers, emails, whatever you think might support your answer, and you'll send all that back to DDD. At that point, while it gives us a really good idea of what goes on in your home, it doesn't give us the whole picture. So we do want to have member interviews as part of this assessment process. This might look a little different than we had originally planned because of COVID, but we're kind of thinking right now it would be small groups of members, just doing like a group interview, so they can give us their perspective on, you know, the things that they like that's going on in the home. There's also an observation element because normally these assessments are done on site. This will probably look very different because of COVID. Some health plans are doing a webinar similar to this, but with video access. So providers can just kind of give them a tour of the home and let them see what's going on there. Finally, there is a community interview aspect. This isn't, you know, just asking questions to any Joe Schmo on the street. This is really if you have someone who interacts with your setting regularly, so either coming in to participate in activities, or someone that your group goes out in the community a lot to see, we would want you to provide their information to DDD so DDD can call them up and just hear from them about all the great things that you're doing from the community perspective. Some health plans, including DDD, might want to do an on-site. So they will call you and try to work this out to see if it's a possibility. You'll have to let them know what would make you comfortable to do that, you know, so of course masks and social distancing and things like that. But that'll all be part of the conversation to see if that on-site could actually take place or not. And I'm going to throw it back over to Dara now.
Thanks, Danielle. And as part of an introduction to this slide around tips, one of the questions we received from Mark was, when are the self-assessments due? So Mark, the self-assessment will be due when your on-site visit takes place or your visit takes place. So DDD will send it out ahead of time with a deadline and specific information on when they will be there to conduct the audit. So you'll have plenty of time to complete that, as well as we will be posting the finalized tools to the website very soon so that you all can take a look at them and get a feel for what's in them and what they ask, and then also the directions, so you can kind of pre-plan or in anticipation of that visit, or maybe even do somewhat of an internal audit yourself in preparing for that. So we will make that available to you. So good question. So as far as tips goes, one of our biggest tips is be creative. Whether or not we're in the midst of a public health emergency or not, compliance with the Hcbs rules can look very different for particular settings based upon what services you provide, who you provide them to. Maybe you have some particular specialties or unique needs of members that, so what you do as a provider may look very different than what another provider does. While the standards are the same, you have a lot of creativity into developing what are those new practices to support compliance. We also want you to be really creative. Danielle went through some examples of how you're documenting or demonstrating that you do meet the compliance standards or will meet the compliance standard. Whether that could be, it could be an on-site demonstration of something, it could be a picture of an activity calendar that you have, it could be a policy and procedure about how you train your staff about these things. It could just be, if you're a developmental home, it could be, the family calendar, for example. So it can be different things. And so we really do want you to develop things that make sense for the setting you have and the people that you serve. Because we're in the midst of the public health emergency, as Danielle, when she went through what does this look like in practice, many of the things and the standards are things that you've had to curtail or restrict simply to mitigate risk during the public health emergency. So you'll have a transition plan where we want you to highlight what it is that you had to curtail and how you plan and how you met members' needs during the public health emergency for those specific things that you did have to restrict. And then, what are you going to do in the future? How are you going to maybe even come back stronger with respect to compliance with the Hcbs rules than you were even prior to the public health emergency? So that's really your opportunity to walk through, your plans and put a plan together as you begin to transition. Next slide. A little bit about reflection. So we've done some of this internally, and it kind of just came about as we started to talk about re-engaging the Hcbs rules process during a public health emergency, which we were really forced to do for a couple of reasons. One, CMS did extend the timeline for compliance with the Hcbs rules to March of 2023. It was March of 2022, so we did get a year's worth of extension, and we lost about a year. We also wanted to make sure that you had ample time to get an assessment, get some technical assistance and support to be able to comply before that timeline, because you can't provide Medicaid-funded services after March of 2023 unless your setting is deemed compliant and maintains compliance. So it's really important. We didn't want to keep waiting to support you to get to this place. One of the things that we thought about is, what could we take from our individual COVID experiences and how we could apply this to our professional life? And when we look at the HCBS rules, we're talking about combating social isolation, making sure restrictions are individualized for people, and then, finding creative ways to support people to engage in the community, even when they may have specific needs. So some of the questions we thought we just kind of get folks reflecting on as we move into the discussion portion of the session today is, have you experienced social isolation in the past year as a result of COVID? I'm pretty sure all of us could say yes. What did that feel like? What did it feel like to not connect to people that were meaningful to us, or to activities? And then certainly we've all experienced our activities being restricted, and that being a determination by somebody else. They made it very well intentioned, right? Understandably restricted our engagement in the broader community to protect not only ourselves but others. But nevertheless, we experience restrictions imposed upon us. And then thirdly, as you all did in providing services, both individually and personally, we've all developed creative ways to connect to meaningful people or activities in our lives. I love music concerts, so I bought a big TV so that I can stream live music concerts because that was something that I enjoyed doing, for example. So we've all made those decisions. So how can we take those experiences we've had and use them to help us gain perspective on what members might either be feeling now because of COVID and experiencing now because of COVID, but even before COVID was a reality, what we're doing that may contribute to them experiencing these things, and how can we mitigate them experiencing these things like social isolation or restrictions on their activities. So we just thought that might be a little bit of a helpful reflection as we move into the discussion for today. So we have a comment on the community interviews from Diane Logan about, how normative is this process? Says, no one asked my neighbors or lawn maintenance crew how things are going for me in my home. Can we have more discussion of what the intended outcome of these interviews are? What information are we looking for, and what types of questions would be asked? So sure, and we're going to make that tool available on the website. I think really what we're getting at here, Diane's good question, is really more about, again, these are not just random people that don't have a relationship with the group home or have a regular engagement with the developmental home and the family that provides services there and the member there. These are people that are active parts either of the program or part of the community. And really it's just a matter of gaining a perspective from somebody else on really just understanding what their engagement is with the group home. It could be a restaurant that's frequented. It could be a place that the group home goes on a regular basis, or it could be somebody who volunteers to support the members to do certain things. So it's really not about just asking random people. It's just getting an outside perspective, although of somebody who's on the inside, as to the meaningful engagement of the members' activities in the broader community and participation in their community and what that looks like. So I hope that helps answer the question, but we certainly can get into more detail into that in another session, but we will also have those questions posted to the website in that tool. And then just want to highlight, we have Diana Taylor from DDD on the phone, and just identifying that she put out the email address with any questions, but that DDD is planning on doing actual site visits throughout this year, and then we'll be notifying you appropriately ahead of time so you have time to prepare for those visits. So thank you both, Diane and Diana. It was hard to say. But going into the questions, this is really, next slide, please. We have two questions for today, and we can spend, we have some time to spend on both of these, fortunately. So this is really your opportunity to share with us what you've been doing. So thinking about the HCBS rules involving members in the community, the focus areas, individualizing member choice and integrating your settings in the community. What practices and activities did you have to curtail in order to assure member health and safety? And what innovative practices and activities did you replace them with? So as we're in the public health emergency and over the last year, what did you have to curtail? I think we can all pretty much anticipate what that answer is. But what did you replace it with? How did you try to ensure and mitigate that social isolation and those restrictions and the impact of that on the members? What were some of the innovative things that you did? Now, you may not think it's innovative, but I'll tell you, we've done 4 sessions of these like this week, and there's been a number of things people have brought up that maybe just seemed standard to them, but was helpful for somebody else. So I think that let's go ahead and open it up if anybody wants to share.
If you'd like to share over the phone, make sure to use that raise your hand feature, and I will allow you to unmute yourself. Just a word of warning, you may be double muted. You may have to unmute your computer and your phone if you called in. You can also share in the Q&A chat box if that's easier for you. And it looks like we have Susan Coons who wants to share. You should be able to unmute yourself now. Let's see. Maybe she doesn't want to share anymore.
While we're waiting for the next person to unmute themselves, maybe I can address a few things in the chat. So Rick talks about the residential agreement and how does that align with DDD's Article 21. Well, we have had conversations with DDD, and we'll have continued conversations as we look at the residential agreement. So that definitely is an active conversation. And then we'll work on some drafts of that, and then we'll also be working through our work group process. Some of you participated in the work group process to flesh out that more, as well as probably provide it for broader public input before we make it something that's final. So this is one thing you will not be assessed on that's in the assessment, but you won't be assessed on it until we actually have it available and it's put into practice. But that's a really good question.
And I'm not seeing any hands raised. I really want to challenge you guys to please share over the phone. I mean, we've had DDD day program and employment program sessions, and they are doing some really interesting things. Oh, there we go. Now we have some. Tammy Leedy, you should be able to unmute now.
Hi, good morning. This is Tammy. So one of the thoughts that I had in regards to supporting members in the home where they want to choose when they eat and what they do is to be able to have house meetings and to come up with house rules. So I know back in my college days when I lived together with a group of people that we had house meetings, and we all talked about what we wanted and how we wanted it to be in regards to visitors and loud music and etc. And if we come up with establishing those types of minutes and discussions, would that suffice HCBS regulations in regards to meeting some of those individualized choices?
Yeah, I think I'll speak and then Danielle, if you want to add in. I mean, no, that's exactly, as long as it's clear that it was member driven and members decided on that. So for example, members decided, okay, we're gonna allow visitors to come up until 11 o'clock. And then we don't allow any visitors to come after 11. As long as that's member directed, then that would be your documentation for the assessment where it talks about visiting hours. You would document or have something to show to DDD that we had a discussion with the members, everybody's agreed They came up with the time that they thought was reasonable, and everybody's in agreement with that. So exactly, you've described what's very normative and natural for people to do when they live together, as long as it's not directed by you as the provider.
And
Thank you.
yeah, I'm in complete agreement. It is not easy to live with anyone. I mean, family or roommates. It's not easy. So it's very normative for those conversations to take place.
Danielle, I think it might be good just to stop for a second. That just to clarify, just given some of the chat that we're seeing, so you will not be able to unmute yourself. When Danielle calls your name, that means that she's unmuted you. And then in order for us to hear you, you may have to unmute your phone. And then you may also have to unmute your computer, which means if you scroll down to the bottom of your screen on Zoom and you go all the way to the left, you'll see a little phone there. And you may need to click on that to unmute yourself.
Thank you, Dara. Looks like we have some more hands raised. Marie Lofton. Oh, that's weird. I'm getting an error message that I have to promote unique. But we'll do that. Are you able to unmute now, Marie?
Okay, I just unmuted myself. Can you hear me?
Yes, we can.
Okay. So in some of our homes, we've had people that kind of taken new hobbies, and I know several of our homes did like gardening in their backyard. So activities to be able to do within their home, they'd be able to enjoy the good weather and do gardening. We've had people like rent those jumpy house activities or the inflatable slides. That way they're, again, bringing the fun to their home, so they're able to still have fun but do it safely. And I know a lot of those places even let you kind of extend them because they weren't getting a lot of business, so they'd let people keep them for like a week. And then we've also done where our agency, like last Easter, and then we're getting ready, we're doing it this Easter as well, where we made Easter baskets for all the members and services, and we're driving them out to, you know, the doorsteps of all the homes and kind of bringing a smile to their face in that way. And then for Christmas, we did a parking lot event in our parking lot of our office, and they came, and it was a drive-through, so we had their Christmas presents ready, and we had take-home food ready, and they were able to just basically drive up, and everybody was wearing their masks and doing social distancing, but we still got to have that yearly party that we had with them at Christmas time too.
That's a great idea. Great ideas. Thank you. Thank you for that. That's great. I want to add, Raphael talked about again, trying to keep with the same idea of things that you would normally do. But Raphael said in our day program, we moved to using tablets and computers to still participate. We moved from regular gym visits to taking them hiking and riding bikes in the community around the homes to stay active and fit. We also challenged some of our members to purchase Fitbits so they can track their own steps. So it's great. That's even sort of taking it a step further to give people skills to help build more independence around their own fitness. So great ideas. Thank you all for, thank you, Raphael, for sharing that.
That's very cool. Something I should do. Monica Attridge, you should be able to unmute yourself now.
Can you hear me?
Yes, we can.
Perfect. Well, Marie took my drive-through Christmas party. But that was something we did down in Prescott at our facility. And we had a grant that was meant for other things, but the grantors agreed to let us purchase WeFit systems for the group homes and a bunch of lawn equipment and games in order to keep people moving around and whatnot. So that worked well. And I apologize if I missed this, but what happens during the monitoring process if you don't have anyone from the community that for them to talk to? I mean, we've kept everybody out and, you know, haven't gone anywhere. So do we get dinged for that?
No, you won't get dinged. It's not like a pass-fail assessment. We're just trying to see how compliant you are. And that is completely reasonable and understandable right now with you know, being in the middle of a pandemic. So it would just be a conversation to take place between you and the DDD when they go out.
Okay. All right. Thank you.
Thanks, Monica. I just want to answer a question from Felicia, because I think this is probably something that's on people's minds about, you know, she asked, will the ISP or the planning document be updated to ask the questions necessary to evaluate health and safety and where we should restrict a right? And that's exactly right, Felicia. There's a new person-centered planning document, or ISP, that will be rolled out beginning in June. It'll be kind of phased in implementation, so you all kind of might see it in different phases, but that's exactly right. One of the changes to that is the opportunity to outline those individualized restrictions if they meet that health and safety criteria. So great question, Felicia. So yes, that's coming.
And I don't see any more hand raised. So if you want to share over the phone, please. Oh, Tammy, I see your hand raised, so go ahead.
Can you hear me?
Yes, we can.
Oops. Okay. Yes. So I just wanted to comment about the person-centered plan, which is great. And I know from my experience that we have guardians that don't always support person-centered planning, and that they have very strong opinions about restrictions and things in regards to their son or daughter, et cetera. And we are always advocates and supporting, you know, choice, et cetera. But I think it's very, very important then that this is documented in the document, the planning document, if the guardian is opposed to things, because guardians can be barriers to helping, you know, assisting us to try to advocate and get people integrated in the community where, you know, a mom or dad may not agree. So it's just real important that these conversations take place and that it's very specifically outlined in the document. And if it is, then, you know, we've done our due diligence, right? And that shows that, you know, how does the team look at a guardian's final word on something, you know, and what do you do about it?
Yep. So Tammy, you've raised, outside of the staffing issue, you raised the other issue that has come up in all of these sessions around that exact issue. And how do we support guardians and family members to come along, right, and feel safe in decision making, but at the same time, you know, trying to advocate for the member and their ability to have these rights. It's a tough conversation, and it's conflict resolution, which is not easy to do. And so one of the things that we hope to have is another session like this, but focusing on the topic of that specifically, with our partners with the health plans, whether it be for DDD, obviously it'd be support coordination, but to have that conversation about what do we do in those circumstances. We also are going to be working on some member and family member directed communications about the Hcbs rules to kind of also help build some awareness about what we're all trying to collectively do. So you absolutely raise an issue. The other issue, and I see chat from, I think it's from you and also Rick Hargrove around the staffing challenges, not only just getting workers, but also how do you accommodate from a staffing perspective if people have different choices they want to make throughout the day. So we also plan to address that specifically in a separate session, because it is an overarching theme for the Hcbs rules, and something that providers have regularly shared with us that are challenging. So appreciate that feedback and insight. I think the one thing that excites us is to hear you talk about that you're wanting to advocate, you're wanting to do these things, you're wanting to support people to make these choices and have these opportunities. And that's, of course, the assumption that we operate under, but it's also really great to hear that directly from you as well. So thank you for sharing those comments.
Dara, we don't have any more raised hands. Do you want to go on to the second question?
Sure. And while we're doing that, we can also go to, so Rex Matthews asked the question about the self-assessment, which is a good one. Is it per site or one for the entire company? So I want to share that, and Diana, maybe you can weigh in on this, but I believe we certainly don't want to duplicate, right? So there may be specific policies and procedures that your organization has that's across the board, across all your group homes and so forth. And so we certainly want to capture those once, but for those items that are very specific to the setting itself, we need to have those specific responses. So I think that'll be somewhat of a little bit of dance on that, just depending upon that, but we don't want to duplicate effort. So where you have things across the board, those will be documented, but where there are things that are specific to each individual setting, we do need to have those documented separately. So next question. Some of you have already brought up a few things. So thinking about COVID being an opportunity to, as we start to transition back, right, we're starting to phase in some things and phase out other things. So how do you as a provider, what are some things that you're doing to either return to where you were prior to COVID with respect to member integration and these things that we, the different standards under the Hcbs rules, or do you have plans for even coming back stronger, that you have ideas of how you can even further increase your agency's alignment with the intent of the Hcbs rules? So we want to open it up. And again, what are those innovative things that you're doing that can be shared with others as ideas to support this transitioning? And I think now is probably a good time for us to be having these conversations as we both personally and professionally are thinking about, okay, what's safe to do now versus what do we still need to wait a little bit to do, and how do we, how do we learn from that to maybe enhance our quality of life moving forward? I don't think any of us is going to take for granted the things that we were able to do before. So how do we make those things more meaningful in our members' lives here going forward? So we'll open it up for input and ideas. Don't be shy. This is a judgment-free zone, so we want you to share.
Looks like Rick wants to share. You should be able to unmute yourself now.
Good morning, everybody, or afternoon now. There are a lot of agencies out there that oftentimes informally met many of the items indicated in the Hcbs rule areas. And I guess this is just an editorial comment that now that we're sort of institutionalizing the compliance with the rules that were probably created because there were some bad actors out there that weren't offering many of the common sense items included, it's sort of now forcing all of us to go down the road where, we always offered choice and we always let our residents of our group homes have keys to their bedroom locks. And there's a lot of agencies out there that did many of the things that are included. Now, you know, they're just all being assessed, but they go to just that 1/nth degree past what we were able to do informally that makes it more difficult. And, you know, I appreciated the comment earlier about when you're a roommate in college, you don't get up at 2 a.m. and take a walk, because that would be discourteous to your roommates if they were to wake up and find out that you weren't in your room. Everybody would panic, and it would be a concern. And so it's just trying to formalize these plans. And I don't have any plans that I could share with the group that are innovative or that are going to help my organization be in alignment with some of the rules. We do have a lot of things already in place, but not to the degree that the rules require. And so we'll have to, you know, sort of take everybody's best practice and improve our own agency in order to be in compliance. I don't necessarily see the COVID risk as changing it very much. I think, you know, this is just a new way of living for everybody. And, you know, we're going to do what we have to do to minimize that risk with or without the Hcbs rules implementation. So anyway, it was just sort of an editorial about there's people that have been doing this for many, many, many years and meeting many of the requirements. And now it's just being formalized.
Yep, and thank you, Rick, for mentioning that, because that probably could have been an important point for us to make earlier. That, and we made this very clear during our development of the assessment of our state and where we stood, as well as during our public comment, that, you know, there could be people that are, you know, exceed what these standards are, and there could be people who don't at all come close. I think the challenge is that, or what we're asked to do as a state, is we have to demonstrate that each setting complies. Otherwise, we can't justify that setting to continue to provide Medicaid services. I mean, that is what CMS has required of us. We have to provide them setting-specific level data on compliance. We're obligated to do that. And so certainly can appreciate what you're saying, and we anticipate finding that more often than not, in particular that settings are compliant. We do have to demonstrate it. I think once we get to the point that we demonstrate our state's compliance, or what are we doing for those few that aren't, and how we're supporting them, then, you know, we really haven't had much discussion with CMS about what happens after that, like what happens after March of 2023. We're certainly not going to let up on the standard, right? But we may have some flexibility as far as the amount and scope of what these assessments look at. So definitely appreciate the comment and feedback.
Tara, I don't know if you can hear me okay?
Yeah, we can hear you.
Okay, this is Diana Taylor with DDD. First of all, good afternoon, everyone, and thank you very much. I want to explain to Dara and Danielle how much we appreciate this type of meeting. I think this is well warranted and needed. We want to let you know that DDD has done a shift in our monitoring process. We will be completing these assessments, but it's a supportive role from the division. Our intent is to help to guide you to be in full compliance if there are areas where you are not. So we will be doing the self-assessments with plenty of warning. We'll notify you, and we'll come to your location to do that, to eliminate all of the transfer of documentation. We'll actually work with you and provide technical assistance at your location. Our monitors will not be doing our normal monitoring process this year. We'll be working through this process. So doing those member surveys and the on-site reviews, I think, is going to be beneficial to help to provide some feedback to make sure that we can meet those little tiny areas that we may not be in compliance, or overall we've got one location that is not working where the rest are. Our documentation that's being reviewed, if you have a policy and procedure that provides an overall view of the entire agency and you've implemented that, that would meet the requirement across every single site. There may be specific line items that we need to verify site specific, and we'll cover those as we go through the process. Bear in mind, this is a learning process for all of us, not just you, but we're definitely here as the role to provide support this year, specifically to every single location to make sure that we can obtain full compliance for every single area by the time we get to the deadlines. We've got an email address that's DDD monitoring, monitoring @azdes.gov. If we don't have an answer for you for questions, we will work to try to resolve those and we'll get back with you. So please feel free to reach out to us if you have any additional questions.
Thanks, Diana, for that. And I think ongoing, I think one of the things that we want to accomplish in these sessions is having more specific topic related sessions, and we will bring in our colleagues and partners with the different health plans, in this case DDD, to have some discussions both with their case management folks, with their quality folks like Diana, and then also with folks maybe that represent the workforce development and can help just, talk about staffing, recruitment, and other things to support those efforts. So certainly are using your comments today to help us develop some themes around some of the future training sessions to have more detailed information.
And Tammy, I see your hand raised. You can go ahead and unmute.
Thank you. So I have a comment about, of course, choice, and that currently where people are living right now in the past might not have had the choice to move where they moved. So, but moving forward, we can show and put in place our intent to always show that members have choice and that they can tour a home to make the decision that they want to make. But when you come in and do a self-assessment and start talking to members, you're going to hear people say, no, I didn't choose my roommate. I didn't choose to live here. And so how is that going to impact us and our self-assessment in meeting the rules when in the past this hasn't been done, but we can show our intent moving forward in regards to members choosing where they live and all of that.
So I think you bring up a good point. I think that just to reiterate that the member interviews are an important part of helping to validate the provider assessment. They're one of the tools to help validate the provider self-assessment. Some of the input, just like you get on any survey or interview, right, could be, well, it was like that years ago, but it's not like that now, right? Or it could be just somebody's perception that may be different than actually what happens. I mean, there's all those things that happen, but we really feel like understanding whether it's, understanding the member perspective on these things is really important. Is one specific thing going to say, well, this provider's out of compliance? No, it's really looking at kind of the whole, all of the different assessments and discussions and things that happen to create an overall picture of what's going on. And it presents an opportunity, right? So to your point, you can't go back in time and change those things. But there can be maybe some education that happens with members about what's changed and what's new and different for future choices they want to make. So we obviously, I think you bring up a good point, but I also want to stress that there's a lot of reasonableness to this process. It's not going to always be black and white, but it's going to be, what can we do? Let's just say you do allow roommate choices, or you do that all the time. But the member that's interviewed is like, nope, never allowed it. I've wanted to room with Danielle, never gotten to. And maybe there's like other factors that have contributed to that decision. Maybe Danielle doesn't want me to be her roommate, for example. That would never happen, of course. But So, there's obviously a reasonable test to this, but it does present an opportunity to have conversations. And I think that is one underlying value we're going to see from this process, where we're elevating these discussions that maybe we didn't have before, that we do now, to talk about how do we move forward. So I hope that helps. It's a little bit nuanced, but that's also, Diana said it right. We're all learning. We're all making our best effort. And ultimately, our goal is to get every provider there. Our goal is not to weed out providers. That is in no shape or form ever been any intention we've ever had around these rules. Our goal is to help, to work as a community, both access the health plans and you all, to get you to a place where we can say, yep, you got it. You understand it. You got it. You may have these two things that you need to work on, but we're not concerned about you, and we'll come a year later and you'll work on those things and you'll show to us how you address those. That's really our goal here. But I think you raise a good question, and certainly something that needs to be considered as we move forward. Just want to highlight, I don't know, Danielle, do you have any hands raised at the moment?
Not right now.
Okay, so I'll just go to the chat. So Robert Barker from Rusty's Morningstar Ranch just provided some comments about how they're transitioning. Obviously, they have a unique setting, and just talking about how, members, of course, are excited to getting back to volunteering, and how they've educated parents and guardians about the Hcbs rules, and will use the person-centered planning process to be that vehicle to sort of remedy where there's misalignment. So that's great. Thank you. And then Raphael mentions that our members will be going back to program settings via COVID rules and structure, but our homes have always had activity calendars with activities, most of which the members are given choices of things to do. We just plan on doing what we can with what is open, with little risk or concerns. That's understandable. We love going to the movies, eating out, going grocery shopping, attending church, hiking, visiting family members, etc. Our plans were merely nothing more than having a planned out activity calendar so that our members are not just sitting at home like couch potatoes. So understanding that transitioning back should be fairly easy, or just, pretty consistent with what things were like before. So thank you, Raphael, for that. Anybody else have anything to share? Okay, well, this will not be the last time that we get together. We can talk about a little bit of wrap up here. Just want to thank those of you who did share today, both in writing and verbally. Unmute yourselves successfully. It can sometimes be a challenge in these environments, but just want to thank you for your participation today. And let's talk a little bit about what resources we have available and what resources we'll make available to you soon. So hopefully you're very familiar with our Hcbs rules webpage. The very number one thing you need to do to make sure is that you sign up for the constant contact under the Stay Informed tab. That way, when we update things on the website or there's an opportunity for training, that you have all of that information as soon as we make it available. There are recorded training sessions already on the website. They were things we did back in late 2019, early 2020, but they're still relevant today. Encourage you to take a look at those. Danielle will be updating the website and posting the recorded sessions from this week for each setting type next week. So you have an opportunity if you want to refresh or go ahead or refer one of your staff or colleagues to view the information, you'll have that. We will continue to add. So we're going to continue. This is basically the first session in the Part 4 series. So we're going to continue to add based upon different topics of discussion. Again, some of the things that we've highlighted provider participation in the person-centered planning process? How do we address, families and guardians who are limiting members when we as a team don't feel they need to be limited or restricted? How do we do this with staffing? Like, what are some creative ways that we can accommodate individualized choice with activities and support while also not putting a huge burden on our staffing situation? Definitely future topics that we're going to for sure have. You're welcome to share with us any additional topics as you start to move forward in this process, so that we can plan those accordingly. The other things that we will add to the website in the near future, probably within the next few weeks or so, are the actual tools themselves. So again, you can take a look at them. You can, maybe do your own kind of self-assessment, pre-self-assessment to kind of just see where you lie. Certainly, I would look at them specifically to, particularly around the ideas of how to document. To Rick's point earlier, some of the things that you're doing are just things you've done for years, right? So how do you document compliance? Danielle, can you take over?
Sure. So as Dara was saying, we do want to have those assessment tools posted to the website in the next couple of weeks. We're working on finalizing a couple more things. We do have, as she said, some recorded training sessions available that we did previously in 2020 and 2019. So some of that information obviously may look a little different because of COVID, but eventually that is where we want to get back to. We also have the Hcbs at azaccess.gov. That email address goes directly to Dara and I. So if you have any questions, if you have topic ideas for future sessions like this, or you just have a general comment you want to reach out to us, that goes directly to us. As Diana stated earlier, she posted in the chat an inbox where you can reach DDD directly if you have some comments or questions about their assessment process specifically. But otherwise, as Dara said, we want to continue doing these sessions so you guys can really talk to each other, troubleshoot, ask questions. We're all in this together. We believe that most of you are already compliant. Kind of along the lines of what Rick said, we know a lot of this is done in practice, and now we just have the extra step of figuring out how to document it and show CMS the great work that we already know that you're doing. We know you guys go above and beyond for our members, and we can't thank you enough for how you problem solved and strategized and figured out, in the middle of a pandemic, how to keep your members in touch with their family and friends and doing activities. You guys have been really remarkable, and I know you don't get enough thanks, but we do appreciate everything that you do for our members. I can't say it enough. You guys are, angels on earth, just amazing, amazing work. And we've been so happy to hear it throughout this week and with today's session. So you will hear from us again, just a word of warning when we start scheduling out these additional sessions that we'll be creating based on the feedback from the sessions this week. So just, you can sign up for our constant contact email address on our website under Stay Informed to receive all the notifications about upcoming events and new tools that we'll have available on the website. So again, we appreciate everything that you do. We'll speak to you again soon, and I hope you all have a wonderful weekend. Thank you, everyone.
Thank you, everyone. Have a good rest of the day.